On the whole issue of children with life-limiting conditions, it's something that I and my colleague Deputy Billy Kelleher has raised here on a number of occasions, both as topical issues and in leaders' questions. Now, it goes without saying that providing care for a child with life-limiting conditions is something that is highly challenging, both physically and emotionally, for families. And we have about 1,400 children currently in the country with life-limiting conditions. About 350 of those, unfortunately, die each year due to their conditions. And the life expectancy of many of those children is just 1 year. And I think all studies have shown quite clearly that the majority of parents want to care for their children at home. Our party has recently been informed of difficulties arising following the failure of the HSE to take over home care plans for children currently supported by the Jack and Jill Foundation, who have reached or will soon reach the age of 4. 3 such children are in North Dublin. One of them a little girl who was 4 last August. She has Ohtahara syndrome, a rare infantile epilepsy with seizures, which has a limited life expectancy. David Cameron's son died at 6 of this same condition. This girl cannot walk or talk or feed herself. She is totally dependent on others, and up to now she was receiving 40 hours monthly from the Jack and Jill Foundation, and this made all the difference to her family. The HSE met this girl's family in July after Jack and Jill and the public health nurse did an assessment and assured the parents that this would be sorted out on or just after her 4th birthday. It hasn't been sorted. Another boy, who will be 4 on Sunday week, has DX West syndrome and chromosome 8 and 9 abnormality, and like the little girl I mentioned, cannot walk or talk or feed himself and is totally dependent on others. He only sleeps for about 4 hours a night. Mum and Dad are understandably up with him on those occasions. The family use their 44 hours of Jack and Jill support over 4 nights, giving them 1 night a week, guaranteed sleep and a few hours each day. The public nurse has told the boy's mother that she won't get a nurse, which she desperately needs, and therefore the mother will have to continue to meet his needs 24/7. Another little boy, who was 4 last week, has a diagnosis of trisomy 7p associated with severe to profound developmental delay. He needs 24-hour care as he is gastrostomy fed, requires suctioning and CPAP, which is continuous positive airway pressure, a treatment that uses mild air pressure to help the airways open at night due to the sleep apnea that he has. He needs numerous medications on a daily basis. In June of this year, a referral was sent into the HSE for a home care package to replace the nursing hours that Jack and Jill's Children's Foundation has provided over the last 4 years. An assessment was carried out and the family was told that their hours could hopefully be replaced. However, at the end of October, the HSE has not made a decision about this home care package. This little boy is just out of hospital this week and his parents are very worried as to how they're going to cope with his needs. I understand that Jack and Jill has set up a temporary emergency fund to cover these hours over the next month, hoping that the HSE will make a decision about replacing its hours. The parents' wish in this case is that funding will continue to run through the charity so that the same nurses can continue to care for the little boy at home. Minister, I suppose what we're asking you here is, will you look at these 3 particular cases, which are in themselves part of a much bigger scenario, and will you, really in the interests of human decency, will you direct the HSE to take action on these 3 specific cases?
Minister has 4 minutes to respond.
Deputy, I'm always, you probably know me long enough, I'm always loath to direct people unless there's actually, I consider that there's belligerence there, and I don't think there is in these cases, but I do undertake to take a look and make inquiries about what can be done in relation to the 3 particular children that you speak about, and have to remember that they are children. I'm pleased to take the opportunity to outline the current position in relation to home care plans for children currently supported by the Jack and Jill Foundation and reaching their 4th birthday. The Jack and Jill Foundation offers a care package to families in respect of palliative care, nursing and home care to children with life-limiting conditions. This funding is provided to the families following assessment by a member of their home nursing team. The Jack and Jill Foundation, along with other contracted service providers, are part of a range of services that receive funding from the Health Service Executive to provide services to families with children who have life-limiting conditions. Many children availing of services provided by Jack and Jill Foundation also avail of other specialist hospital-based and community-based health supports and disability services. And I do know that in those circumstances, it is always preferable that the child would be at home in as much as they can be. Each HSE area has a home care coordinator who has responsibility for the planning and provision of all home care packages in their area, including for those children receiving supports from Jack and Jill Foundation who are reaching their 4th birthday. Home care packages are delivered based on an assessment of the applicant and/or their families. This assessment takes into account all services being provided by all agencies to ensure that the delivery of an integrated package to meet the assessed needs. A care plan is then agreed and delivered by the HSE voluntary or private providers or a combination thereof. This process ensures that all children with life-limiting conditions receive services on an equitable basis through a standardised approach. The HSE Disability Services provides annual funding to the Jack and Jill Foundation under Section 39 of the Health Act 2004. In 2013, the Foundation received funding of just over 630,000. The Foundation also raised additional finance through fundraising activities. They get that money because they are a good foundation. It's as simple as that. The Jack and Jill Foundation also engaged with the Primary Care Division of the Health Service, which has given an additional budget of 1.2 million in 2014. National Service Plan to address specific service challenges in areas such as the discharge of special care babies from hospitals who have tomies and require packages of care in the community. My department is currently following up with the HSE in respect of one particular family who have a child who has just reached 4 years of age. I'm assuming that's one of the children you talk about, Deputy. And if the Deputy has any particular case in mind, I would appreciate it very much. It's not that you're welcome to, but I would appreciate it very much, Deputy, if you could let us have the details, and we will pursue it with the HSE. Thank you very much.
Well, look, most definitely, Minister, I will supply the information you request to you, and I have confidence in you insofar as your commitment to intervene is concerned. But there is a broad issue here. You seem to suggest that there is natural follow-on from the care provided by the Jack and Jill Foundation with very little state subvention. When one considers the amount of work that is done by the Jack and Jill Foundation, the 630,000 that they got in 2013 is a very small percentage, and indeed a far smaller percentage than the monies made available to many of the Section 38 organisations. But there isn't, in reality, the sort of follow-on from the HSE that you describe, because time and time again we hear from the Jack and Jill, and we hear directly at our clinics and in our constituencies from parents of children with these life-limiting conditions that the sort of continuity of care that they would expect to get and that we would all aspire to see them getting just doesn't happen. And the very fact that I have to come onto the floor of the House today and instance these 3 examples to you is proof positive of the fact that whatever system you aspire to having in existence is not working. Now, I've heard you speak very eloquently recently about the problem with senior citizens in hospital while awaiting step-down facilities. And obviously there's a huge cost to the Exchequer and to the health services in meeting the demands of older people. These children's needs are so complex that for them to remain in hospital involves expenditure that is far in excess of anything that might be spent in terms of meeting the needs of older people. So from an economic perspective, we all have, I think, a vested interest in ensuring that what their parents wish for them, which is to have them at home and to care for them at home, that objective is realised.
I'll be very brief. There's no disagreement. The ideal is that it would be a seamless service. that the service should not be interrupted just because the child reaches a particular, I suppose, chronological milestone. The ideal would be, of course, but circumstances maybe won't permit us to do that. The ideal, of course, would be that the nurses that are delivering the home care at the moment would continue to do so. And that is the argument I will be making, Deputy. I'm sure there are 100 reasons, I'll be told, why that can't happen. And I'm sure there are other service deliverers as well who would be anxious to deliver it. But of course the ideal would be that the child and the family would continue on with the service which they're receiving now. I will inquire about it. It shouldn't happen. And I will do my very best to ensure that a resolution is found to these cases. But as you say, it's not just about these 3 children. It's a broader problem.